I want to tell you about a pattern I see over and over again in my practice. I see a patient has been on antidepressants for years, has tried 2, 3, sometimes 4 different medications, and nothing really worked. When I ask about their childhood, lifelong struggles with focus, staying organized, finishing things, the answer is yes. They probably didn't have depressive disorder. They had ADHD and nobody ever recognized it. Are you one of those? Or are you a clinician wondering why antidepressants aren't working for your patient? What if some people diagnosed with depression actually have untreated ADHD? What if the research we rely on, the diagnosis that we make, and the treatments that we prescribe are built on a foundation that has a critical gap? I am a family physician focusing on mental health and ADHD. My main goals are to educate and advocate for people living with mental health challenges, ADHD, and neurodivergence. Everything I share here is for education only. Please don't change or stop any medication without speaking to your doctor first. In this talk, I'm reflecting on patterns I have observed in thousands of patients which have made me question, is there something we are missing? Depression is one of the most common mental health diagnoses. It's not just about feeling sad. It's one of the leading causes of disability worldwide and is strongly associated with suicide. Thousands of people die by suicide every year, and many more struggle with suicidal thoughts. This is why getting the diagnosis right matters. If we misunderstand the cause of someone's suffering, we may also miss the most effective treatment. Today, I will talk about 3 important points about depression. First, what is happening in the brain of someone with depressive disorder? It sounds complicated, but I have made it really simple. Second, how ADHD can mimic depression so closely that it can get missed, and why current medical definitions and diagnostic tools can be misleading. And third, I will talk about treatment and management of depression with or without ADHD. Before going further, I want to emphasize one basic distinction which I see is often missed. Same as anxiety, there are depressive symptoms and there is depressive disorder. These two are different. They are not the same, but they are often mixed up. Depressive symptoms are feelings of sadness, low energy, or emptiness that many people go through, often in response to stress, loss, or a difficult period in life. They are real and they matter, but they are not the same as depressive disorder. Depressive disorder is when those feelings become persistent, affect almost every area of life, and don't lift, even when things around you improve. This is what gets formally diagnosed and treated as depressive disorder. So what is actually happening in the brain when someone has depressive disorder or ADHD? And why do they look so similar? Let's start with the 3 brain chemicals that are especially important to understand. First is dopamine, which is the motivation and reward chemical in the brain. In ADHD, the brain doesn't release, recycle, or respond to dopamine efficiently, especially in the prefrontal cortex, the planning and focus center of our brain. This creates a chronic low reward state. Ordinary tasks do not feel satisfying or motivating. People often seek activities that increase dopamine, like food, shopping, gaming, social media, or substances like cannabis. This is one reason ADHD can cause what looks like depression. Not because the person has a mood disorder, but because the reward system is chronically understimulated and life feels flat. In depressive disorder, dopamine system can also become underactive, which is one reason people lose motivation, interest, and pleasure. The difference is that in ADHD, this pattern is usually lifelong, while in depressive disorder, it often develops during and limited to the depressive episode. Then we have norepinephrine, the brain's get up and go and do things signal. It works closely with dopamine and is also often low or dysregulated in ADHD. It affects mood regulation, energy, the ability to start tasks and keep going. Both ADHD and depression can involve low norepinephrine, which is why they look so similar on the surface. The third one is serotonin, which helps keep our mood steady and emotions stable. It plays a central role in depression. When serotonin is low, small things can feel overwhelming, sleep and appetite can change, and it becomes harder to bounce back from stress. What many people don't realize is that serotonin also plays a role in ADHD, which is one more reason why these two conditions can look so similar. Depression isn't just about low serotonin. Serotonin is only one piece of a much bigger picture. In reality, all three systems, dopamine, norepinephrine, and serotonin, are involved in both ADHD and depressive disorder, and they all interact with each other. This is a big part of why these two conditions can be so hard to tell apart. And here is something worth knowing. Years of living with unmanaged ADHD can actually affect the serotonin system over time, meaning the depression that develops may not just be a reaction to a hard life, but may involve real changes in the brain itself. When you look at the brain chemistry, it becomes clear why ADHD and depression can be so easy to confuse and so easy to miss. So why do these chemicals become imbalanced in the first place? Often there is more than one reason. First is genetics. If ADHD or depression runs in the family, the brain may be wired from birth to process these chemicals differently. Second, early life experience. Childhood stress, trauma, neglect, or growing up in an unpredictable environment can reshape the brain's stress response and how these chemicals are regulated. Third is chronic stress in adulthood. Ongoing stress keeps the body flooded with cortisol, the stress hormone. Over time, high cortisol can affect the brain regions responsible for mood and motivation. Finally, lifestyle factors. Poor sleep, physical inactivity, social isolation, chronic inflammation, and substance use can all suppress the brain's ability to produce and use these chemicals effectively. The key point here is depressive disorder is the result of a vulnerable biology meeting a difficult environment, and it's out of one's control. So now that we understand how these two conditions share the same brain chemistry, let's look at how depression is actually diagnosed and why that process has a significant gap in it. Based on DSM-5 criteria that clinicians rely on in diagnosing mental health conditions, major depressive disorder is defined by 9 main symptoms. A person must have at least 5 of these during at least 2-week period. At least one symptom must be either depressed mood or loss of interest or pleasure. Now I'm going to briefly review each of these symptoms and discuss how they may overlap with ADHD symptoms, leading to a missed or wrong diagnosis. The first symptom is depressed mood, most of the day, nearly every day. In both ADHD and depressive disorder, people can feel low, frustrated, especially under stress or after repeated failures. The difference is that in ADHD, mood is often situational and fluctuating. For example, someone with ADHD who is unhappy in a job may feel sad, irritable, and frustrated at work. But once they are at home or out with friends, they can be cheerful and engaged. Their mood tends to track with the environment and with the stimulation. In depressive disorder, mood tends to be more chronic and pervasive. It affects work, home, and social life. The person feels low or empty even when nothing obviously bad is happening, even in situations they used to enjoy, and even after the situation changes for the better. The second symptom is markedly diminished interest or pleasure in almost all activities. In both ADHD and depression, people may do less than they used to, withdraw from hobbies, and say they feel unmotivated or numb. The difference is that in ADHD, people can hyper-focus intensely on a new interest, like painting, gaming, or a hobby, and then quickly lose interest when the novelty wears off. They still have motivation, it just shifts. They look for new stimulation rather than losing all interest. In depressive disorder, the loss of interest is global. Someone who has always loved painting, music, or sports or something finds that nothing feels enjoyable anymore. Even their most meaningful hobbies feel flat or pointless. Symptom number 3, significant weight loss or gain, more than 5% of body weight in a month, or a major change in appetite. In both conditions, ADHD and depressive disorder, appetite can change. Eating patterns can become irregular and weight can go up or down. The difference is that in ADHD, people may skip meals because they are hyper-focused or distracted, or they may simply forget to eat until they are starving. Binge eating and emotional eating are also common, often as a way to self-soothe or to stimulate themselves. In depressive disorder, changes in appetite tend to be more persistent and more pronounced. Significant weight loss or weight gain can happen over weeks to months, with a sustained loss of appetite, or, on the other side, overeating to numb feelings of sadness or hopelessness. Number 4, insomnia or hypersomnia nearly every day, let's say every night. In both ADHD and depressive disorder, people may have difficulty sleeping, poor quality sleep, and daytime tiredness. The difference is that in ADHD, the sleep problems are usually chronic. People often have racing thoughts, difficulty winding down, or a lifelong pattern of going to bed late and struggling to wake up. These issues often begin at a very young age in childhood and can be present even when mood is good. In depressive disorder, changes in sleep are often more episodic and tied to the depressive episode. Fatigue or loss of energy nearly every day is another symptom. In both ADHD and depressive disorder, people may feel tired all the time, drained or burnt out. The difference is, in ADHD, many people feel exhausted because it takes so much effort to compensate for weak executive functions. They may have bursts of energy for things they enjoy and feel drained by routine or boring tasks. In depressive disorder, fatigue is more global. Even favorite activities feel like too much. Getting out of bed, showering, getting dressed, and going to work can all feel overwhelming. Remember, these symptoms must last at least 2 weeks. It's not about just few days. Number 6, feelings of worthlessness or excessive or inappropriate guilt. In both conditions, people can be very hard on themselves and feel like they are failing at life. In ADHD, years of criticism and unmet expectations, being called lazy, careless, or irresponsible, can create deep feelings of inadequacy and worthlessness. These feelings are often tied to specific situations like school, work, or relationships where they have struggles. In depressive disorder, guilt and worthlessness are usually more pervasive and sometimes irrational. People can feel guilty about things that are not really their fault, or they may have a general sense that they are a bad or worthless person, even when others wouldn't see them that way at all. Here just another reminder. One should have at least 5 of the 9 symptoms to meet criteria for depressive disorder. Now we are 6 symptoms in, and we are still describing the daily experience of millions of people with undiagnosed ADHD. Number 7, diminished ability to think or concentrate, or indecisiveness. I don't need to say anything about this. This is the core symptom of ADHD. Both ADHD and depression can show up as trouble focusing, mental fog, and forgetfulness. The difference is that in ADHD, trouble focusing has always been there. They have always struggled with attention, organizing, following through, especially on boring or repetitive tasks. These difficulties often go back to childhood. In depressive disorder, concentration can be fine at baseline, but then gets worse when the depressive episode starts. Someone who previously managed work or study perfectly fine suddenly cannot focus even on simple tasks that used to be easy. Number 8, psychomotor agitation or retardation. People with ADHD often fidget, pace, feel restless inside and out. They may have difficulty sitting still, and this has been there since childhood. In depressive disorder, it tends to look different. Speech, movements, and thinking can become noticeably slower, and the person may seem physically heavy or withdrawn. Another symptom is recurrent thoughts of death, suicidal ideation, or suicide attempts. People with ADHD have significantly higher rates of suicide ideation, attempts, and even completed suicide, commonly rooted in impulsivity, emotional dysregulation, rejection sensitivity, and co-occurring depression. I want to pause here for a very important note. I hear a lot from patients that they have or have had suicidal thoughts, but they may or may not be strong enough to plan or act on. When the thoughts are strong, it's more serious. Suicidal thoughts are not a sign of weakness. They are a signal that the brain is in severe distress, much like a fever is a signal that the body is fighting something serious. Like depressive disorder itself, this is not something a person chooses or can simply think their way out of. It's a symptom of what is happening in the brain, and it's out of their control. When that signal appears seriously, it means the brain needs urgent medical support. This is why we always ask, if suicidal thoughts become serious to the point that they start planning how to end their life, go to the emergency room or tell someone who can help them get there. Getting help quickly is never an overreaction. It's the right response to a medical emergency. So now coming back to the DSM-5 criteria, the symptoms must cause clinically significant distress or impairment and cannot be better explained by substances, another medical condition like thyroid issue, iron deficiency, or another psychiatric disorder. A general statement. As you can see, almost every single one of these 9 symptoms can also appear in untreated ADHD. The DSM-5 specifically and rightly tells clinicians to rule out bipolar disorder before diagnosing depressive disorder, which is absolutely right, and I will talk about that in another video. But it says nothing about ruling out ADHD. In my view, this is a significant gap and may cause misdiagnosis and mismanagement and costing many people the right diagnosis. The tool most commonly used to screen for depression is a questionnaire named PHQ-9, developed in 2001 and still in line with DSM-5 criteria. It may be useful, but it can't tell you whether what you're looking at is depressive disorder, is it ADHD, or both. My observation is that most people with ADHD completing this questionnaire score in the moderate depression range. And when you ask them, do you see yourself depressed? They think and say, I don't think so. Doctor said I am depressed, but I don't think so. That's why a questionnaire alone is never enough. We need to ask more questions and rule out other conditions, including ADHD, before reaching for a diagnosis. And if you are watching this and wondering about yourself, here are 2 questions that you can ask yourself. When things are going reasonably well, do you feel okay? Or is the low mood always there in the background? Is there anything that still makes you feel a little better? Certain people, activities, environments? Or does everything feel flat no matter what? Here's the question I keep coming back to, and I don't think current research has answered it yet. How many people who are currently diagnosed with depression actually have untreated ADHD, not depressive disorder? To the best of my knowledge, we still don't know. There's a major blind spot in the literature. Numerous studies have been done on depression, but most rely on questionnaires that are not specific enough to distinguish depressive disorder from other conditions. I'm not aware of any research study that systematically ruled out ADHD before diagnosing depression. So the true proportion of depressive disorder versus depression due to unrecognized ADHD remains unclear. What I can tell you is what I see in my practice. The most common pattern is not someone with both ADHD and true depressive disorder happening independently. It's lifelong ADHD symptoms living in a world that doesn't understand and doesn't recognize neurodivergences years of struggle, criticism, and failing to meet expectation. A life built around coping and compensating, and eventually a mood collapse that looks exactly like depressive disorder. I want to be clear. I'm not suggesting that depressive disorder is not real, or that most people diagnosed with this condition actually have ADHD, but I do believe that undiagnosed ADHD represents a significant blind spot in both clinical and research practice. If ADHD is not assessed before a depression diagnosis is made, some of those people may be getting the wrong label and with it, the wrong treatment. So how can you tell these two apart? The honest answer is that it's not always easy, and sometimes it needs a specialist who is also experienced on ADHD. What do we actually do about all of this? Let's talk about treatment. And I want to start with something that might surprise you. When it comes to treatment, there are three main approaches: medication, therapy, including CBT and mindfulness practices, and lifestyle changes. Most of the time, the best results come from combining all three. Now, a common question is, should I take medication, or are therapy and lifestyle changes enough? Practicing CBT and mindfulness and right lifestyle are the mainstay which is recommended for everyone regardless of severity of their condition. Medications can help correct chemical imbalances if they are the right medication at the right dose for the right diagnosis. But medications don't fix the thinking patterns, habits, and environments that contribute to depression or ADHD-related burnout. That's where CBT, mindfulness, and other evidence-based therapies come in. For mild to moderate depression, therapy and these practices alone can be enough. However, when depression is moderate to severe, when getting out of bed, concentrating, or engaging in therapy is hard, medication is usually needed to stabilize things enough for therapy, lifestyle changes, and recovery work to become possible. A practical way to think about it is this. Imagine someone with a badly broken leg. You can teach them all the physiotherapy exercises in the world, but if the bone is displaced, they need surgery first before rehab can even begin. Medication is not the recovery, but it creates the grounds that make the recovery possible. Regardless of whether medication or therapy is part of the plan, these lifestyle foundations matter for everyone, with or without a diagnosis. 1. Prioritizing good quality, refreshing sleep. Spending time outdoors daily, ideally at least 30 minutes. Regular physical activity. A minimum 30-minute brisk walk increases a brain chemical called BDNF, which supports the growth of new brain cells and builds long-term resilience. Managing diet, especially reducing refined carbohydrates that contribute to energy crash and systemic inflammation. Reducing chronic stress as much as realistically possible. Meditation practices and building supportive routines help. And something I see every single day in my practice. If ADHD is part of the picture, addressing it directly is often the most important step of all. You may want to know how antidepressants work and when they don't work. The most prescribed medications for depression are SSRIs, selective serotonin reuptake inhibitors. They block reabsorption and so increase serotonin in the brain. Now, serotonin and dopamine have a very complex relationship. Depending on which receptors are involved, boosting serotonin can actually weaken dopamine activity. And this matters because dopamine is already underactive in ADHD brain. Serotonin can also regulate emotions and impulse control, mood swings, and frustration intolerance that many people with ADHD struggle with. So, in one hand, when someone with undiagnosed ADHD takes an antidepressant, it may quiet the dopamine system even further, so they may feel emotionally flat, less motivated, or like a zombie on SSRIs. On the other hand, some people with ADHD, particularly those with significant emotional dysregulation, may benefit from a low dose of an SSRI alongside their ADHD treatment, not alone. Not as a replacement for ADHD treatment, but as an addition. So it's not that serotonin is simply bad for ADHD or good for depression. It's more nuanced than that. And that's exactly why treatment needs to be tailored to the whole picture, not just the diagnosis on the page. So what if both ADHD and depressive disorder are present together? Sometimes even after careful assessment, it is still difficult to tell whether there is depressive disorder, ADHD, depression symptoms, or both. It needs regular follow-ups, and only over time we can confirm the diagnosis. When it comes to management, we always start by asking which one is causing more problems right now. And assuming there is no other condition in the picture, like bipolar disorder, very important, a practical approach depends on what is impacting their life the most. If depressive symptoms are severe and the person is struggling to function, depression must be addressed first. If there is active suicidality, that is urgent. Safety always comes first. If depressive symptoms are mild to moderate and ADHD is strongly suspected or already diagnosed, it can be reasonable to prioritize treating ADHD first. If depressive symptoms improve significantly with effective ADHD treatment, which is quick, that tells us ADHD was likely playing a major role all along. If depressive symptoms persist, even when ADHD is well controlled, then true coexisting depressive disorder becomes more likely, and an antidepressant or other depression-focused treatment may be needed. Honestly, majority of my patients are in the first group. Addressing ADHD solves many of their problems. There is no one-size-fits-all management. It always needs to be tailored to each person's situation, history, and risks. A common question is, how long medication should be continued? Depression is not always a one-time event. For many people, it comes back, and each time it does, it can become a little easier to trigger and a little harder to treat. This is why getting the right diagnosis and the right treatment from the beginning matters so much. One of the most common mistakes people make is stopping medications too soon, often because they start feeling better. So let me share what the guidelines actually recommend. After a first depressive episode, the general advice is to continue medication for at least 6 to 12 months after full remission. After 2 episodes, treatment often continues for at least 2 years. After 3 or more episodes, many guidelines recommend long-term treatment, sometimes indefinitely, because the risk of relapse becomes very high. We know that medication alone is not enough. At the same time we start medications, patients should be learning CBT, cognitive behavioral therapy, and mindfulness skills seriously, and practicing them daily until they become habits. They need to see every threat as an opportunity to practice mindfulness and CBT. Without that, after stopping medication, the chances of relapse with even the smallest life challenge become very high. The right medication at the right dose can bring someone to remission, but it's the daily practice of CBT and mindfulness that helps keep them there. For those whose depression symptoms are ADHD driven, staying on top of their medication means fewer life struggles and fewer triggers for both depression and anxiety symptoms. Now I have a message for my fellow clinicians. Before diagnosing someone as depressed and starting an SSRI, it's worth screening them for ADHD too. It can improve the clinical picture. Screening tools like the PHQ-9 may be useful for screening, but they are not diagnostic. Many items on PHQ-9 questionnaire can also be seen in adults with untreated ADHD: poor concentration, low motivation, sleep problems, fatigue, feeling bad about oneself, and loss of interest in activities. We need to screen for ADHD at the same time using a simple questionnaire like ASRS, the Adult ADHD Self-Report Scale. When someone has tried 1 or more antidepressants and is still not getting better, if you haven't screened them for ADHD before, it's now worth pausing and asking some important questions before adding more medication or switching to something else. Is this truly depression? Or is this an unrecognized ADHD that has been there all along? Ask about lifelong pattern of inattention, disorganization, emotional dysregulation, mood swings, frustrations, outbursts, and underachievement. What was childhood like? Is there a family history of ADHD or other neurodevelopmental conditions? Behind every missed diagnosis is a person, someone who may have spent years believing they were lazy or unmotivated or not trying hard enough. Someone who may have been prescribed medication after medication while the real problem remained unnoticed. And sometimes the most powerful thing we can do is spend a little more time, ask a few more questions, and see the whole picture. Because sometimes changing a diagnosis changes a life. In my last video, I talked about anxiety disorder. My next video will be about bipolar disorder, which again has overlapping symptoms, with even more challenging diagnosis and a very different and critical treatment approach. If this video resonated with you, whether you are a clinician, a patient, or someone who has been wondering about their own diagnosis, please share it with someone who needs to hear it. Thank you for watching.